Alaikum wa rahmatullahi wa barakatuhu. Welcome to the Nourishing Traditions. And today we will be talking about infectious diseases. So let's dive in. The key to understanding the infectious diseases basically involves understanding of its counterpart, or paradoxically, the understanding of cancer. So a lot of bacterial infections, they start growing in an environment where they see a lot of abnormal growth. That's cancer. And that's why we say a cancer patient is highly susceptible to various illnesses. Because of these bacteria releasing different chemicals around the cancer cells, we observe that these chemicals are anticancerous. And they are known as TNF, the Tumour Necrosis Factor, which are used as anticancerous agents or anticancerous drugs in treating tumors in human cells. And this was first observed by Dr. Lloyd, who was working in the Sloan Kettering Cancer Center. So why am I talking about cancer and infectious diseases? The main thing is bacterial infections come where, or bacteria themselves come where they see some scavengers are needed to rescue the normal body cells from an abnormal overgrowth. So let's see why. All of the major illnesses in the body's main mechanism for cleaning itself are tiny illnesses which occur every season, or they are not turned into any chronic illness. And we all know that there is a difference between acute and a chronic illness. I'm not going to go there. But furthermore, whenever doctors have ignored this connection between the acute and chronic illnesses, or they have rejected the therapeutic powers of acute illnesses, the incidence of chronic illnesses occur. Although it's true that microorganisms can infect us, and they can, but they can do so only in certain conditions. Like if we consider a body as a terrain or a soil, and we can easily grasp that it is large part of this soil or terrain that determines our condition of health, or whether these bacteria, they can infect us, or they can grow in us and they can flourish in us. It all depends on the environment we provide to our body. By environment, I mean the blood, the lymph, and other floras of the body, which need to be cleansed. And therefore the organs, like the cleaning organs, the liver and kidneys and spleen, and they cleanse themselves if they see any toxins in the form of food, environment, pollutants. They tend to react. Let's look at this example. Let's consider a fish which is swimming in a pond, and we keep on throwing plastics and metals and cans and other toxins in her pond, and we see that the fish are dying or they feel sick. So to treat the fish, are we going to inject her with antibiotics or vaccinations, or we're going to clean up the pond for her? If we treat her holistically and clean her pond, her environment, her house, her terrain, she will get those nutritious good vibes from her environment. Her blood's gonna thrive with all those good nutritious ingredients which she really requires to thrive, and her breathing will be healthy. Her gills will start flowing in that neat and clean water through, and definitely it's gonna live a healthy life as living in a dirty pond. One of the tenets of the anthroposophical medicine and most successful natural healing systems throughout the body in the history of mankind is the percept that many diseases occur when an individual becomes too hardened, too sclerotic, too hardened on themselves, too hard on other people, So we harden naturally and gradually as we age. Themselves too hard on other people. So we percentage of water declines in our tissues become elastic, and this is a natural and normal cycle of life, and it should not lead to illnesses, nor it should be a cause of concern unless aging is happening too quickly. And as we see, the biological processes and the age of human bodies are declining as we are reaching more and more advancements in food and in other things. But all times and all people, they had longer ages and they lived long. Of premature aging can be varied, and one of them is sclerosis, that is hardening. And when it accelerates, the process of hardening accelerates. So number one reason can be the synthetic vitamin D, which accelerates the process of aging, and it's normally present in our pasteurized milk. And another example can be the vegetable oils, which harden the arteries, and that can lead to other diseases such as atherosclerosis and heart attacks, etc. Or exposure to violence in childhood, which can lead to hardening of the soul, like cynicism, skepticism, and these things, they really holistically, if you look at a person, it really matters on the overall health of a person, because everything, you can control your health from your mind, from your belief system, and from your feelings. So once you start controlling those feelings, you start having a control on your overall health. Inflammation is our body's cleaning mechanism, and this can be understood in 4 steps. So number one can be the response of body, which is in the form of fever. That's the body emitting heat. Response of body, which is in the form of fever. And the second response can be the blood is brought to the site of affected tissues, and that can be redness, because the blood is trying to heal the part which is affected. The third response is swelling. As the body brings more lymph and WBCs to the site of infection, that part swells. So swelling is often accompanied by the production of pus or mucus, and it removes dead tissues, bacteria, dead bacteria. So in a way, all of these symptoms of heat, fever, swelling, pus production, the body is trying to tell you that it's cleaning itself. And finally, we experience pain, or our consciousness is brought to bear that phenomena of inflammation, just so that we can pay attention when we feel pain. Now, inflammation is a body's response to cleaning itself. It's a cleaning response or a cleaning mechanism. And the only possible response which can be to sclerosis. So inflammation is the way we bring about balance in our bodies. Our therapies for inflammation and infectious diseases, they should not suppress the mechanism of self-healing. And these conditions, when they occur in a natural way, they kind of help the body to re-establish the balance, get rid of toxins, re-establish those biologically, biochemically normal processes in our life. And if we find ourselves getting sick too often, then we should make an effort to eliminate those factors. Clean your food, clean your environment, clean the air you breathe in. Be physically, emotionally, mentally, spiritually upright, and work on yourself, work on your spirituality, mental health, work on your emotional health, invest in these, invest in your physical health. These, if they are making us too hardened, too sick, and too sclerotic, then probably there are something we're missing on the bigger picture. If we suppress our inflammatory response too vigorously, we actually push our biochemical balances more towards hardness, and we see ourselves in bed, sick, resting. And this is one reason when suppressive therapies, they are our main medical model and a go-to, and more people, they become chronically ill. For example, when we use antihistamines, we're simply suppressing the release of histamines, or when we use H1 antihistamines, which act as a sedative, and they go and suppress your CNS, your central nervous system. So you're simply putting a patient or a child to sleep, or by inducing sedation. So promethazine and chlorpheniramine were the first generation antihistamines, which were used a few days back in Gambia, and it killed, unfortunately, it killed 28 children because of most probably the harmful effects of these sedatives, the way they're used for cough, and overdosing. It could be because of overdosing, and the children, when they sleep, they don't get up. So we will be looking at alternate therapies for infectious diseases, how to stay fit, and how to deal with in coming out of that toxins when the weather is cool and when winter is approaching, how to help your body detox itself. We will be looking at other therapies from natural healing and from anthroposophical medicine, from homeopathy. So inshallah, I will be guiding you through those. Stay tuned, and thank you for listening. Like, share and subscribe. See you next time. Ma salama.